Hey everybody, this is Dr. Ed Gigliotti from Upper Cervical Chiropractic of Rochester. Today I want to review an amazing case study that occurred in our office from an incredible woman that we've been blessed to care for a few years now. When she first began care, she reported having really debilitating neck pain that went down to the shoulder and the back, upper back, that was happening every day. So this pain was getting worse as the day progressed. So by the end of the day, she relied on Advil and then also heat to just get through the night. With those, she was having consistent and significant headaches. Anybody who knows our office knows that migraines, headaches, and vertigo are a big reason why people come to see us. So I wasn't surprised with this representation when she came in that she was also having headaches. Low back pain was also a factor with her. It would happen occasionally, and she was getting pain radiating down her left leg. So a number of things affecting her with her health. Well, with all of this grouped together, she was having difficulty sleeping. So she reported right on the initial intake, I can't sleep. I feel like I never sleep. She was just tossing and turning all the time and didn't feel rested in the morning. So you can imagine how this would affect someone's quality of life and every aspect of their life, from their relationships to their work, everything. It's a big deal. So we did neurological testing to find out could there have been an injury, especially to the upper cervical spine, that could put stress and tension on the brainstem and cause dysfunction from brain to body communication. Okay, as you know, the brain is obviously held in our skull, right? And the lowest part of it comes down to around the C1, C2 level. So this is like a big neurological circuit occurring right here. It's a big deal, okay? So if there's ever injuries where these vertebrae can twist out of position, it could affect a lot in a negative manner. So we did the neurological testing. It indicated that something was going on. So we took 3D imaging to see what was happening. This here is the original images. Now, remember, we're looking at bones, but what matters is everything inside. Whenever you see bones out of position, think about how the soft tissue would be affected inside, okay? From ligaments to tendons to fascia to muscles, but most importantly to nerves, to brain tissue, to all of that, okay? So when you look from behind, check this out. First thing I want you to see is this is the back of her skull. Here's her jaw. Here's her neck. Look at the head tilt. You can see that the right side was higher than the left when she was just looking straight ahead. It was actually, there was a tilt. With that, you can see how these vertebrae, these are the back, they're called spinous processes. Look how twisted they were to the right compared to the left. Look how much of the bone you can see on the left compared to the right because they were all shifted. Okay? So we got this amazing woman under care. She had... really significant. She had 5 misalignments, okay? So what she had was her occiput, her skull had slid backwards to the left, probably from the fall, maybe even something earlier than that too. So it was a left posterior occiput. Her C2 vertebra, as you can see here, had twisted to the right, okay? Now, the C3 and C4, what had happened is they'd gone backwards on both sides, but they were twisting a little bit more to the right also, but they had actually slid backwards on both sides of the joint. So we got her checked. We started getting her agented very gently, no twisting, popping, or cracking. And these are, we were following up with the case consistently, but this is the most recent films we took just a couple months ago. Look how cool this is. It was actually less than a month ago. So I'm going to go here. So this is now. How cool is this, guys? First thing I want you to note is look how level the head is. And look how untwisted these vertebrae are. It is so cool. So again, that's before. And then look at the head tilt and look how twisted that is. And look at now. It's so cool. So there was other changes also on these films. And remember, the changes matter because that means that space is being maximized inside, which is, it's all about life expression. Blood flow, cerebrospinal fluid flow, and then also nerve signals going to and from the brain. So I'm going to show you this now. Another thing I want to show you is the side view. So this is a side x-ray view. It's automatically included in the images we take. We just decipher the data the way we need. So this here, okay, is her teeth. Here's the the side of her skull and the back of her skull and the atlas vertebra. What I want you to notice here is that look at the space in between the atlas and the occiput on the original. And then I want you to see it now after specific and scientific chiropractic care. Look at it now. Look how much closer it is. I'm going to go back and forth so you can see that again. So look at that space. And look at it now. It's so cool. The reason why that matters, guys and gals, is because when the atlas moves forward or back, it moves in this direction because of the way the joints are. So if it's too far forward, you'll see an increased space between the occiput and the atlas. When it starts to go into position and starts to open up that canal, on an anterior atlas, when it starts to get back into position, what you'll see is you'll start to see where it reduces here, even though the head's in the exact same position, because it's the head's actually sitting on the atlas better. How cool is that? Now, the coolest view we love is the top down, because that shows the actual like canal where that brainstem would be going through, the vertebral arteries, all cerebral spinal fluid flow going to and from the brain. So it's a really big deal. And I'm going to show you the before and after on that. Okay, this is the before. So as you can see here, this is the opening of the skull, or the foramen magnum. This is where the back of the skull would be. This is where her nose would be if you could see it. Okay, and we're looking top down. So you want to see symmetry from left to right on these images. And then also you want to see that the atlas and C2 are centered to the skull. Now this is the center opening of the skull. Okay, and look how much kick to the right the atlas and C2 are. And remember what I explained before. With our calculations, we found that the skull, the occiput, had gone backwards and to the left. So because of that, if the skull's going backwards to the left, you would see more space here between the skull and the atlas compared to here. Okay, and that's exactly what you're seeing. Now, after very gentle adjusting and consistently getting her checked when she needed it, okay, so she stayed on track. She didn't wait to fall apart to get under care or to stay consistent with care. She's like, I want to transform my future. And look how cool this is now. Look at that. So as you can see now, look how much closer it is. The atlas and the C2 vertebra, look how much closer they are to the occiput, and look how much more centered they are. And I'm going to show you this again, comparing. That's before. Look at the space, because the atlas had slid forward or the skull had slid backwards, any way you want to look at it. And look how much more space there was and how it was torqued to the right. And look at it now. How cool is that? So just so I could full circle this, she now reports that her sleep is much improved. Her mobility, which she didn't even tell us she was having difficulty with mobility on the original intake, but it's so much more improved than it was. No more neck pain. It's a thing of the past. And the headaches are few and far between now. If she rarely has them, generally there's a correlation that she's out of adjustment, like she did something to stress her nervous system, and then we can get her adjusted, and she reports noticing a big change almost immediately. But it's not like these significant and consistent debilitating headaches like they were before. So it's like, you think about this, if she's having that type of change in her quality of life, what else do you think is happening with her physiology and her function? It's like there's so many people struggling, and the issue might be closer than they think. The solution might be closer than they think. It could be right here, you know? So love and appreciate you guys. This is so cool. We see these types of situations in the office, and we're always so excited. Our whole team is, including our docs, because it's not a small thing when you can get pressure off of the central nervous system. If you know somebody that's struggling, headaches, migraines, vertigo, neurological issues, neck pain like this person here, please share the message. If they don't live around here, that they can get to our office, we will help find them an upper cervical doc in another city or state. It is our pleasure to do it. Okay? We love and appreciate you. Thank you for tuning in, and I hope you enjoyed this. Thank you.